Today's topic is nasal septum. Welcome medicos. Let's begin with a positive quote. Little progress is still a progress, so just keep moving ahead. So how do we approach a question in anatomy? We always write headings and we always draw diagram wherever possible. And at last, we always try to write an applied anatomy or applied aspect. Let's take a question. Describe the nasal septum under the following heading: formation, blood supply, nerve supply, lymphatic drainage and clinical anatomy. So this forms a 10 marker. But most of the time nasal septum will appear as a 5 marker question in your university exams, and it can be like formation, blood supply, clinical anatomy, or formation, blood supply, nerve supply. Any combination can be there. Also, along with nasal septum, there is one more important question: lateral wall of nasal cavity. Either of these questions has high chance to appear in your university exam. Introduction. The nasal septum is a median osteocartilaginous partition between the two nasal cavities. What does osteocartilaginous mean? Osteo means bony part and cartilaginous means cartilaginous part. So we have both bone and cartilage forming the nasal septum. Let's talk about the formation of nasal septum. So first of all, we'll talk about the bony part. We have perpendicular plate of ethmoid, vomer. Also we have nasal spine of frontal bone, crest of nasal bones, etc. But most important thing for us is perpendicular plate of ethmoid, vomer. So you can easily draw this diagram. Just make an inverted, a little tilted T, and the upper part will be the perpendicular plate of ethmoid, which forms the posterior superior part, and this is the vomer bone, which forms posterior inferior part. Coming to the cartilaginous part, we have septal cartilage and septal processes. The septal cartilage forms the major anterior part of the septum, and it fits in the angle between vomer and perpendicular plate of ethmoid. And then we have septal processes of the two major LR cartilage, which forms the cartilaginous part of the septum. Now the most important thing, the blood supply. Let's talk about the arterial supply of nasal septum. So these 5 are the arteries. Let's first learn the name. Septal branch of the anterior ethmoidal artery, septal branch of posterior ethmoidal artery, septal branch of sphenopalatine artery, septal branch of greater palatine artery, and septal branch of superior labial artery. Out of these, the anterior ethmoidal and posterior ethmoidal are branch of ophthalmic artery. Sphenopalatine and greater palatine artery are the branch of maxillary artery. You can remember is at PM. Superior labial artery is a branch of facial artery. So let's visualize it with the help of a diagram. So this is a diagram which is given in Visram Singh. So this is the anterior ethmoidal artery. This is posterior ethmoidal artery. This is the sphenopalatine artery. This is the greater palatine artery and superior branch of facial artery. You can see all this anterior ethmoidal, sphenopalatine, greater palatine and superior labial are coming and anastomosing at a place which forms the Little's area. It's known as Kiesselbach's plexus. We'll be talking about it in the clinical aspect. So to revise, what are the arteries? We have first anterior ethmoidal, posterior ethmoidal. Both are the branches of ophthalmic artery. Then we have sphenopalatine artery, greater palatine artery. Both are the branch of maxillary artery. And then we have superior labial branch of facial artery. Venous drainage of nasal cavity. We need to keep these 3 names in mind: facial vein, pterygoid venous plexus and pharyngeal venous plexus. Now the veins draining the nasal cavity form plexus beneath the mucosa, and in general they accompany the arteries. And these veins drain into facial vein, pterygoid venous plexus and pharyngeal venous plexus. To talk about nerve supply of nasal septum, we have 6 nerves: olfactory nerve, internal nasal branch of anterior ethmoidal nerve, nasopalatine nerve, medial posterior superior nasal branches of pterygopalatine ganglion, nasal branch of greater palatine nerve, and anterior superior alveolar nerve. These names do look tough, but once you get used to it, it's actually pretty cool. Let's visualize it with the help of a diagram. So one common thing about the diagrams to be drawn in nasal septum and lateral wall of nasal cavity, this is similar only, just you have to change the names. So here we will begin with olfactory nerves: anterior ethmoidal nerve, anterior superior alveolar nerve, medial posterior superior nasal branch of pterygopalatine ganglion, and then we have nasopalatine nerve from pterygopalatine ganglion. Once you are well versed with this diagram, you don't need to remember that this supply to the anterior superior part, this supply to the anterior inferior part, because from this diagram only you will be able to visualize it and write in your exam. Also, this anterior superior alveolar nerve is a branch of maxillary nerve. Also, one or two nerves is not shown in this diagram, so I'll be showing you one more slide in which all the names of the nerve and where does it supply. Actually, you can directly see from here only that anterior ethmoidal nerve is supplying to the anterior superior part, but let's have a look for this. So the olfactory nerves supply to the upper part just below the cribriform plate, as we saw in the diagram. Then we have internal nasal branch of anterior ethmoidal nerve, which is a branch of nasociliary, and it supplies to the anterior superior part. We have nasopalatine nerve, branch from pterygopalatine ganglion, supplies to the posterior inferior part. We have medial posterior superior nasal branch of pterygopalatine ganglion, supplying to the posterior superior part. We have nasal branch of greater palatine nerve, supplying to posterior part. Anterior superior alveolar nerve, a branch of maxillary nerve, supplying to the anterior inferior part. To talk about the lymphatic drainage of nasal cavity, lymph from anterior half of nasal cavity, both medial and lateral walls, is drained into submandibular lymph nodes. So both medial and lateral walls we are talking about. So both are drained into the submandibular lymph nodes, and lymph from posterior half drains into retropharyngeal lymph nodes. So you need to remember these two groups of lymph nodes: submandibular and retropharyngeal lymph nodes. Come to the clinical anatomy or the applied aspect. We have DNS, deviated nasal septum. It is a common presentation, more frequently seen in males than females. The reason may be due to trauma or any developmental error. Also, if the DNS is severe and if it is causing mechanical obstruction leading to difficulty in breathing, sinusitis, headache, or excessive snoring, it can be corrected by submucous resection or septoplasty. Also, the septal cartilage not only forms the partition between right and left nasal cavities, but it also provides support to the dorsum of anterior two-third, the anterior two-third of the nose. So it is providing support also. So therefore, if there is excessive destruction due to disease or excessive removal in submucous resection, so if it is removed in excess, then it can cause supratip depression of the external nose. The most important clinical aspect here is epistaxis, which means nose bleeding. It can also appear as a clinical case scenario in which, for example, a 10-year-old boy coming to a hospital with nose bleeding, and the parent will be giving history of fingernail trauma following picking of the nose. So what happened here is there is a damage to the vessels in the little's area. So what is little's area? Little's area is present in the anterior inferior part of the nasal septum. It is a commonest site of epistaxis. Why? Because it is highly vascular. So what happens here is the anterior ethmoidal artery, the sphenopalatine artery, the greater palatine artery, and the superior labial branch of facial artery all anastomose here and forms Kiesselbach's plexus. And this area is known as Little's area. Also here one MCQ can arise: which of the artery is not forming anastomosis at Kiesselbach's plexus? So that the answer will be posterior ethmoidal artery. Now the important thing is, what can be the immediate measure taken for nose bleeding? So we can apply local pressure and put a wet cotton swab on the nasal bridge, and the anterior nasal packing with nasal swab can also be done. So this was our question, and we discussed the formation of nasal septum, the blood supply, nerve supply, lymphatic drainage, and clinical anatomy. Hope it was fruitful. We'll get back to you soon. Believe. Just believe in yourself. Thank you.